Hello, my name is Dr. Diwan S. Raja. Today I will discuss about the anatomy of the lacrimal apparatus. Lacrimal apparatus is associated with production of tears and it has multiple parts. These are the lacrimal glands, lacrimal ducts, then we'll go to the Lacrimal Punctum, Lacrimal Canaliculi, then Lacrimal Sac, Nasolacrimal Duct that opens into the inferior meatus of the nose. So let's start one by one. Lacrimal apparatus, components of lacrimal apparatus. We have the lacrimal gland, lacrimal gland. Lacrimal gland has divided into two parts. One is the orbital part and that is the palpebral part. So, orbital part, another one is the palpebral part. Then the lacrimal gland has ducts. We have the punctum, lacrimal canaliculi, then we have the lacrimal sac, then the nasolacrimal duct, nasolacrimal duct. So these are the components of the lacrimal apparatus. Lacrimal gland has two parts, one is orbital part and another is palpebral part. So this is the orbital part and the lower part is the palpebral part. Okay, this is the orbital part, this is the lower part is the palpebral part. The orbital part is larger, that is present in the orbit along the antero-superior part of the roof of the orbit. Here the location of the orbital part of the lacrimal gland. Then here, this is the muscle, this is the levator palpebri superioris muscle. Okay, and this muscle indent the orbital part, upper part indent the lacrimal gland, upper part orbital part, lower part is the palpebral part of the orbital gland. So orbital gland and the palpebral part of the lacrimal gland, orbital part and the palpebral part both together from the lacrimal gland, and this gland is a serous gland. Its secretion is watery and salty. Watery and salty secretion, like saline secretion. Okay, so we got the lacrimal gland, location of lacrimal gland, partly in the inside the orbit, bony orbit, partly in the upper eyelid. Okay, the lower part or palpebral part is the lacrimal gland. Now we'll go to the lacrimal duct. We have around 6 to 12 ducts from the orbital part. From the orbital part of the lacrimal gland. Around 4 to 8 ducts from the palpebral part of the lacrimal gland. From the palpebral part of the lacrimal gland. Okay, we got around 10 to 20 ducts. The ducts of the orbital part penetrate the tendon of the levator palpebrae superioris. Then it passes through the palpebral part of the lacrimal gland and opens into the conjunctival fornix. So this duct should penetrate the tendon of the levator palpebrae superioris, then passes through the palpebral part of the lacrimal gland to open into the conjunctival fornix. Okay, conjunctival fornix is the area between the palpebral conjunctiva and the bulbar conjunctiva. Palpebral conjunctiva is underneath the eyelid. Bulbar conjunctiva covers the sclera to the margin of the cornea. Okay, so if we cut this part, the palpebral part of the lacrimal gland, then we can destroy the duct of the orbital part of the lacrimal gland. Okay, so we got that. The ducts. Now we'll go to the punctum. Punctums are present in the eyelid. If you go to the eyelid, medial side of the eyelid, you'll see punctum on the eyelid. Punctums are present on the eyelid, on the where two eyelids close together, on that surface we'll get the punctum eyelid. Okay, we have one eyelid here on the upper eyelid, one punctum on the upper eyelid, one punctum on the lower eyelid. Okay, then we'll go to the lacrimal. These are the punctum. Okay, and these are the lacrimal canaliculi. Lacrimal canaliculi, that is small canal, okay, that opens into the lacrimal sac. We have one lacrimal canaliculi here, another one here. Okay, this is one punctum, this is another punctum. Punctums are present on the eyelid. We can easily see on the surface of the eyelid, at the upper and lower border of the eyelid. We get the lower border of the upper eyelid. We get the superior punctum. The upper border of the inferior lower eyelid will get the lower punctum. Then we'll get the lacrimal canaliculi opening into the lacrimal sac. Lacrimal sac. Where is my lacrimal sac? Where is our lacrimal sac? Lacrimal sac is present in the lacrimal fossa. Here is the lacrimal fossa. Lacrimal fossa is bounded by the anterior lacrimal crest, posterior lacrimal crest. Okay, so this is the lacrimal bone here. This is the lacrimal bone. Okay, this is the posterior lacrimal crest. This is the anterior lacrimal crest. Okay, we got it. The lacrimal sac in lacrimal fossa. In lacrimal fossa. Lacrimal fossa between the anterior lacrimal crest and posterior lacrimal crest. Okay. Lacrimal fossa between the anterior lacrimal crest and the posterior lacrimal crest. Okay, we got the lacrimal fossa, location of the lacrimal sac. Lacrimal sac is around 12 millimeter, around 8 millimeter on side, 12 millimeter in length. Okay, from lacrimal sac we get the nasolacrimal duct. Okay, then we'll get the nasolacrimal duct. This is the nasolacrimal duct. Nasolacrimal duct. Okay, this is the nasolacrimal duct. Lacrimal duct. Okay, nasolacrimal duct is important to us. Nasolacrimal duct, through the nasolacrimal duct, the lacrimation or tear goes down. Nasolacrimal duct is around 15 millimeter in length. Okay, and nasolacrimal duct opens into the inferior meatus of the nose. Opens into the inferior meatus of the nose. We know that the inferior meatus is covered by the inferior concha, when the meatus here. Here is the opening of the nasolacrimal duct, junction between anterior 1/3 and posterior 2/3. So lacrimal sac is here, duct is opening here. Okay, we got the nasolacrimal duct. Nasolacrimal duct is guarded by a valve. Here is the valve. Okay, this is called Hasner valve. Here is the Hasner's valve. Okay, so it opens into the inferior meatus of the nose, guarded by a mucosal valve called Hasner's valve. Okay, we got the Hasner's valve. So we got the Hasner valve opening is guarding the opening of the nasolacrimal duct. Okay, so we have lacrimal gland is here, sac is here. So how the lacrimation come from here to here? This duct just secretes the secretion of the lacrimal gland. It passes over the sclera and the cornea and by means of the gravity plus by blinking reflex. Okay, and by the action of the lacrimal part of the orbicularis oculi muscle. Okay, so the lacrimation goes there and there is a lake here. Okay, there is a shallow lake here, we call it lacrimal lake here. Collection of fluid a little bit more here and blinking of the upper eyelid, lower eyelid. That blinking usually happen from lateral to medial, so it works like a wiper of a windshield of a car. So the secretion slip over the sclera cornea, goes to the lake and go to the punctum, go to the sac, then it goes through the nasolacrimal duct to the inferior meatus of the nose. Here is the inferior meatus of the nose. So we got the flow of the tear from the lacrimal gland, lacrimal duct, and it passes over the sclera cornea. It clears this and it provides nutrition to the cornea, and it will remove the dust and debris, then goes to here, and from there the fluid goes to the canaliculi, to the lacrimal sac. From lacrimal sac it goes to the nasolacrimal duct, opens into the inferior meatus of the nose. Okay, this is the lacrimal apparatus. Now what is its blood supply? Nerve supply. Okay, blood supply by means of the lacrimal artery. Lacrimal artery. Lacrimal artery is a branch of the ophthalmic artery. Ophthalmic artery is a branch of the internal carotid artery. Okay. Arterial supply. Venous drainage by lacrimal vein. Okay. Then ophthalmic vein. Ophthalmic vein. Then to the cavernous sinus. Cavernous sinus. Okay, we got the venous drainage. Now we'll go to the nerve supply. Nerve supply. Nerve supply by means of lacrimal nerve. Lacrimal nerve carries the general sensory fiber, sympathetic fiber, and parasympathetic fiber. The parasympathetic fiber begins from the lacrimatory nucleus, the upper part of the superior ciliary nucleus in the pons. Then it goes through the nervus intermedius, geniculate ganglion, greater petrosal nerve, nerve to the pterygoid canal, pterygopalatine ganglion, then to the zygomatic nerve, zygomatic-temporal nerve, then to the lacrimal nerve, to the lacrimal gland. That is the parasympathetic. Sympathetic from the superior cervical sympathetic ganglion, internal carotid artery plexus, then the deep petrosal nerve, then nerve to the pterygoid canal, then it will be distributed along with the sympathetic but without any relay in the pterygopalatine ganglion. The parasympathetic will have a relay in the pterygopalatine ganglion. Sympathetic will not relay, it will distribute it along with the blood vessels. Okay, so we got the blood supply, nerve supply of the lacrimal apparatus. Now we'll learn some clinical anatomy. Okay, so this gland may not secrete, so we may get the dryness of the eye, especially in the postmenopausal women. Okay, there may be keratoconjunctivitis secant due to lack of secretion. Okay, there is one. In other autoimmune disease, we may have problem here, and there will be lack of secretion and dryness of the eye. Okay, this is one problem. Another problem is that this duct may be blocked. In that condition, we have over lacrimation, that may happen. Okay, it may be due to excessive production or maybe due to blockage here. Okay, so there may be blockage of the nasolacrimal duct. Nasolacrimal duct. Okay, this two way happen. It may be due to infection, or it may be due to congenital. It may be blocked. We get a condition. We call it epiphora, excessive lacrimation. Epiphora. Okay. So this is one problem. Another problem is that this lacrimal sac may be infected. We call it dacrocystitis. Dacrocystitis. Okay, that is inflammation of the lacrimal sac. Lacrimal sac. Okay, so this is blocked, it is infected, then the ENT doctor, they do the DCR surgery, dacrocystorhinostomy surgery. Okay, and that's all about the lacrimal apparatus. If you have any question, please feel free to ask me. Please share the information with your friends, and please support my channel. Please subscribe me. Have a nice day. Bye now.